Nancy Halupa has been a Toronto emergency room nurse for more than 2 decades, but the job she says she used to love is now one she's ready to leave.
I don't think I can do a fourth wave with this kind of staffing. It's not good for my mental health. It's not good for my family. It's not a workable situation anymore.
In Ontario, the amount of overtime nurses have been working during the pandemic has skyrocketed by 137%. There are now well over 16,000 vacancies estimated in the province's hospitals, and the work, according to Halupa, is crushing those who remain on the job.
Things need to change. It's getting dangerous out there.
At a recent rally, doctors and nurses made it clear patients will pay the ultimate price.
If nurses aren't available to get orders done, to get procedures done and treatments done, patients wait and wait and wait.
The shortages are almost at 50% in some places, and we've lost half our staff. There's almost no shift where you're not short-staffed.
It's not just the workload, Leah Waxman says. Pay is pushing people out too. Ontario's Bill 124 caps wage increases at 1%. That meant a 47-cent raise for Leah this year.
This sort of blunt instrument of this wage suppression bill that's forcing many nurses out of the profession early and ruining and demoralizing a whole group that we need right now.
The province has no plans to amend the bill, and the Canadian Federation of Nurses Unions says Ottawa needs to step in.
We need commitment from the federal government to create a healthcare workforce agency.
An agency that would work with the provinces to prevent healthcare worker shortages and look into national standards and regulations. Halupa says the time for that is now.
It's hard to run a department when you're shorthanded. It's impossible to run a department when you're shorthanded.
Global News did reach out to Health Canada to ask whether it would step in to help manage the countrywide nursing shortage. It says ultimately the responsibility is on the provinces and territories. Mauracher, Global News, Toronto.